All right. Good afternoon, everyone. Good morning from here. Here it's like 9 a.m. In the morning. Thanks for having me. I will be visiting most probably Korea the second half of January, so it would be nice to also catch up with Geist. But let me just first share my screen. It says you can request multiple presenter sharing for this meeting. I send a request, so I guess I need to. Oh, let me see if this. Oh, okay, looks like it's working now. All right. Um, I think you should be able to see my full screen, right? Okay,
Yeah,
excellent.
yes, good.
Excellent. All right. Well, what I would like to talk about today is a little bit about the work that we do here at TU Delft at the Urban Analytics Lab, primarily on measuring accessibility for different population groups, and also looking at how the environment, the surrounding environment, the origins, the destinations, and also most importantly, the routes between them, how they define different nuances for different population groups and how we can integrate those into different metrics, how we have done that. I will show you a few examples, and then I will close off a little bit with a tool, a very cutting edge tool that we have developed here at the lab that integrates, that incorporates all these metrics. And it's very interactive and it's actually open source. So you will also have the chance to work with it. So before moving on, and here you see a lot of things about access equity, right, on the title. And I will today focus primarily on pedestrian accessibility. And the issue with some aspects of like equity has to do with the way that our environments are configured. And even though this might seem absurd as a plan for a home, it seems that we have accepted it over the years in our cities because the proportions that are allocated to the car, as you see here in the plan, it is actually the space that we use for cars in our cities primarily over the past decades. And that you see also that, the usable, the living spaces, in order to move from one to the other, we have to cross like that space. So even if we would find this really absurd and we would never accept it for our home, we seem to have pretty much accepted it for our urban environments. And here come like the difficulties. Now, before I move on with, the measurements and how we do that, we first of all conceptualize this. And the way that we usually do that is that we simply identify a bunch of different origins and destinations. Each one can work one time as an origin or a destination. Here, it doesn't matter like which one is which. And there are the routes that connect them. And these routes, they have lots of different qualities. And so when we try to measure accessibility, when we want to measure how we move from one point to another, and what does it mean for us, the most important aspect there is something that I'm sure you're all familiar with, is called the travel cost. And this travel cost is usually represented as a distance or a time. We see that even more recently gaining more popularity with the model of the 15-minute city that I'm sure you have heard of. And this is something which is very intuitive. However, when it comes to actually spending effort, making effort to go somewhere, and that would be like, for example, on foot or cycling, like with active transport, what really matters is mostly the perception of the travel cost. And that perception can differ substantially amongst different population groups. So it might be that the exact same distance or the same time window might feel totally different to somebody who is a healthy adult and as opposed to somebody who is an elderly person or a small child or persons with mobility limitations or people with other kind of mobility like challenges. So that travel costs can vary substantially, and it doesn't only vary based on our demographic characteristics. It also varies based on the qualities of those paths, of those routes that I show here. So, for instance, how we feel, the feeling of safety or insecurity as we move along those paths can have a great impact on how we perceive that travel cost. And then immediately the exact same distance can feel that it takes like much longer because it doesn't feel safe, for example. Or if the route between the different buildings, the different destinations or public spaces, it's much more or less attractive, it can impact the way that we perceive that travel cost. And then it can minimize or extend like the time of that perception. Same goes for weather conditions. We see that now more often as we are with full of the climate change issues, and that we see that apart from the abrupt events, we also notice differences in temperature, for example, more extreme heat that doesn't really facilitate active travel when it comes to that. So it makes the same distance feel much, much longer. Path slope, something that we here in the Netherlands, we don't really have a lot because we are very, very flat. But in many other countries, in a lot of cities, there are huge slopes on the routes. It can also impact the way that we perceive the travel cost. And then the challenge there is how do we put all these things together? Because all these different factors can have a great impact on how we perceive that. And then actually those routes between those origins and destinations can be mostly like those red lines instead of the black lines that I showed in the initial model. And a lot of times these factors can be contradicting based on the population group that we're looking into. So apart from, intervening on where and how we place those origins and destinations, it's important to look how we can intervene on making these routes more attractive, to feel more safe, to provide, for example, changing weather conditions, and then to accommodate the different needs of different population groups, which is a very challenging thing. And here, one thing in accessibility metrics, we usually have like two main schools, if you want, like two main approaches. We either get like a more place-based approach, so we see like, well, what places we can reach from a given location, or we go for the other side and we look at the individual accessibility for each and every individual, but that unfortunately doesn't scale very much. So each one has its pros and cons. We're trying to look at a kind of middle layer, a kind of middle solution here, which is more group-based. So we're looking at different population groups and how we can incorporate that into our measurements. And I would like to show you now a couple of examples of how we do that and what it entails. So just going back to the basic measurement of accessibility. So for example, this is the plan of Delft where I am right now. And these here marked are the parks, so the main green spaces in Delft. And then if we try to measure access to green areas, to parks in the city within a 5, a 10, or a 15-minute walk to see if there's like the 15-minute city. Oftentimes, in a lot of disciplines, this is just calculated by drawing Euclidean buffers. That means straight line distances around the home locations. And if we did that, we would see that, Delft is amazing. It's 100% accessible. Only 35 of its residents do not really have access within a 15-minute walk. But the thing is that unfortunately, we cannot move in straight lines. We cannot penetrate walls, right? Right now, unless there is a technology that can make us do so, or we become ghosts. I don't know. But the issue is that we're dependent on the network, the street network. And then if we make even that slight rudimentary change, like it's not really something, of rocket science thing. If we just make like this change, then we will see immediately how the actual accessibility following the street network results in a much lower percentage, still very good, but that translates into almost 17,000 residents not having access within a 15-minute walk from their home location. So even this slight tweak. But then we want to add more nuance, as I explained, because these things are much more complicated and it's not just, the street network. So, for example, some work that we've done here in the lab, regarding access of children to green spaces and play spaces, because these spaces have been proven to be very important when it comes to the physical health, but also the mental health aspects and the well-being of children. And then when we look at that, we of course need to know where children are, where children live, because we do not expect that all locations will be equal transmitters of children flows, mobility flows equally across the urban fabric. So we need to see how children are distributed across the urban fabric. And what you're looking at right now is the city of Amsterdam. That's the plan of Amsterdam. And then you see the different percentages. You see primarily that children are around the core of Amsterdam. Here, we do not really have a large percentage of children living, but primarily in those areas, and these are primarily new. So that means that, our origins should not be equally weighted in this time, but then we should focus more on where children could be starting their journeys, their daily journeys, going to schools, for example, and vice versa. So where are the schools and where are the children like heading to their home locations? So if we map that, we can see like that the flows of children, and this is pretty much like a heat map on the level of street segments. So it's a very detailed one. Right now, it feels a little bit more aggregated, but if I zoom in, it's like at the streets segment level. And there you see the heat map of flows of children as they move around the city. So we can see whether they can access any kind of green spaces or play spaces within that area. If we turn that to adolescents, then we see that the travel patterns are way different. We see that they are much more concentrated, and this has to do with the fact that the, let's say, higher level schools are much more concentrated in different areas than elementary schools for small children. And of course, looking at the distances and looking at the flows and the patterns, that's one thing. But then we know that there is much more nuance to that. There are barriers to children that would not allow them to access easily a space. And then perhaps they cannot cross all those routes because they are unsafe or they're difficult for children like to cross. So we need to know these kind of barriers. And for that, we implement different methodologies. Here, what you see is that we are using like workshops with stakeholders to identify these local barriers using the local knowledge, and then identifying different areas and what could be the barriers to children access, or the other end, what could facilitate their access and how we can integrate those into our metrics. And besides that, we also involve planners, policymakers to rank different factors that matter when it comes to measuring accessibility. So what you see here in this exercise that we do, and this is something that is usually used in the field of psychology, and it's called Q methodology, like the letter Q. And what you see over here is that we've asked different stakeholders to rank different factors from the least important to the most important ones when it comes to access for different population groups. So here you have the least important factors, the most important factors, and as you move on to halfway, then we have like factors that are good to have. So in most of those cases, and so a surprising thing is that one of the most important factors that pops up is safety, and I mean feeling of safety, which is very interesting because when most of the planners or policymakers they go back to the drawing table, then they go back to measuring distances and times because that's easier. Whereas feeling of safety is something is a more subjective property, which is much more difficult to measure. However, I will show you how we try to do that as well. And besides that, we also involve crowdsourcing techniques. So what you see here is that we provide through online platforms, we assign this to crowdsourcing workers, as it is usually called in this jargon. So participants of this crowdsourcing campaign. And we assign them different routes in the city so they navigate at street level. So here you see the plan, and what you see are different places that locations that the crowdsourcing participants assessed in terms of the feeling of attractiveness, of the feeling of safety along those routes. So what they did is that they actually followed this route that you see over here, but then at the street level, like walking along those paths, and then in those locations, they gave their assessment. So we combine all these things. We combine the distances, we combine the time parameters, we combine the factors that matter more or less, and we weigh them differently. We factor in different barriers or facilitators of accessibility and a lot of different aspects. And then we come up with new measurements that cater to the specific characteristics of different groups, children in this case, that I'm showing. So what you see over here is the city, the plan of Utrecht. That's a city right in the middle of the Netherlands. And what you see over here is the different walk sheds from different green and play spaces around the city, which can be reached within a 300, 500, and 800-meter walk. That translates in time patterns into a 5, a 10, and a 15-minute walk. But then if we take into account the different barriers, simply here, the different highways that are not easily crossable by children, then we see that, the pattern immediately changes. And if we add those nuances that I mentioned, so here we see from the different, this is what you see here, like the dark purple, these are the different play spaces in the city. And then if we just add the Euclidean buffers that I showed a few slides before, and these are the straight lines, and we would see that we're doing great, like it's 94% accessible. But then if we focus just simply on the street network, then and we see additional green spaces there, then it goes down to 90%. And then if we include the barriers, then it goes to 81% accessibility, which is of course still great, but then it gives a more nuanced picture of what the real situation is when it comes to how accessible different play spaces and green spaces are to children, to that specific group. And then I mentioned the issue of feeling of safety, which is, objective. It's a subjective dimension. It's a subjective factor. So sometimes it is difficult to measure it. So how do we factor in those perceptions? So one way that we try to do that is that we let's say, took some inspiration from the seminal work of Jane Jacobs, you might have heard of. She mentioned something about eyes on the street. So when, there are overlooking windows across the buildings or overlooking windows over the streets, it kind of feels safer because it feels like that somebody is watching. These are two streets from Montreal, Canada, both from the same city. And then you see here that, for example, the fact that the buildings have quite some wide openings along the street, it feels that there are some overlooking windows and kind of gives a better feeling of safety, which can change, of course, at different times of the day. But you see over here that the lack of those openings can have a great impact on how we perceive the safety of the street, and it can, of course, influence whether we would choose to go through that path or not. So what we did is that we developed an algorithm that identifies these openings, different buildings on building facades, and then we mostly use those that there were on ground floor, first floor, and second floor, because these mostly have more contact with the actual street. And then we did that for every single street segment of different neighborhoods. We did that for 110,000 street segments in the city of Amsterdam. And then we compared them to a safety index that we have in the city. And then we identified how the different streets scores, the different areas and the different street segments. So even at that granular level, score in terms of like street surveillance and occupant surveillance. That's actually windows overlooking other windows on the other side of the street. And street surveillance is like windows overlooking the street. So it gives you like a feeling of safety. And then we could classify the different streets based on a high, a medium, and low feeling of safety. And we, in fact, found an interesting pattern over there that, you know, the if you increase like the number of windows, of course, like it sort of seems to increase the number of the feeling of safety, but then it looks like that there's what we call an elbow effect, that when we have more than three windows on every 10-meter street segment, then the more we add, it doesn't seem to have really an effect on how safe we feel along those paths. And of course, it needs more, let's say, study to see how it plays out in different environments, but it proved to be quite consistent across our studies. And so you might be wondering, because I promised it to you, like, how do we implement all of those things? How do we incorporate them into tools that do not go into the, you know, the weird, the difficulties, the nuances of the algorithmic components that there are behind all these processes, but make it intuitive and more straightforward for different people like urban stakeholders and planners, designers, mobility planners, and so on and so forth, to get a better understanding of how this plays out in different cities. So we developed a tool, what we call City Walk Map. And we have done this primarily now. We've tested it in different cities in the Netherlands, and we've made an implementation, and I will show you also how it works. So what this tool does is that it allows you to have immediately like an interactive understanding of what can be accessed within a 5 and a 15-minute walk. These are very important like timeframes, and we see here now with the increasing popularity of the 15-minute city and how this plays out in different environments. But it also showcases like how these things change based on the different characteristics of the routes, the factors around the landscape, the feeling of safety, or even traffic and crime safety, issues of proximity and infrastructure, and all these factors like combined together. And then 4 different population groups, usually for children, for adults, and for the elderly. And now just to go like a little bit step by step, the first thing that we do with this tool is that when you hover over a location, you get immediately an understanding of what is the 5 and what is the 15-minute watershed around that location. And this is calculated based on the street network. And then based on that, we also calculate how many amenities, how many services you can access within a 5 or a 15-minute walk. And then what it shows you here is also a breakdown of the different categories of the places that you can visit, the walk-in area, and then you can see the total number that you can visit. So here within a 5-minute walk, if you're in this area, then you can access 9 amenities in total. Whereas in other areas, it might be that within the same walking distance, you can access 100 different amenities. So you can see how this can translate into different equity or inequity components. The system also, the tool gives you the possibility to look at that at a more aggregate level. So you see the different grid cells, and then it classifies the different grid cells based on high, medium, and low accessibility in terms of the amount of places. And then what it does is it also calculates a very innovative measure, which we call co-accessibility, and is something that has gone unnoticed, let's say, in the accessibility measurements, which, and typically in accessibility, what we measure is like what we can reach or what can be reached within a given, time, travel cost, time, distance, money, whatever, what have you. So what we do here is also like we want to explore who else has access there. So what it does is that it calculates, besides the total number of people who can access an amenity, and it does that by identifying, where people live around in the area. So it needs to be fed with some demographic data, population data. And then it calculates that per age groups, given the different characteristics that I mentioned, and then it calculates a different diversity score. So for example, if you go and click on one of these places, say like this square here, you can see how many children, adults, and elderly people can access it. And then it gives you a score, an age diversity score, to see how diverse this area can be. And let me show you this a more interactive way. So here you can see that as we hover above any location, here you see that you have the possibility to go for 5 or 15 minutes. And then here we have clicked like here, it's activated like the 5. And then for every location, as you hover over those locations, you get an understanding of what you can reach within a 5 or a 15-minute walk. And then if we click for 15 minutes, you see now what does it mean like a 15-minute city here in Amsterdam. That's Amsterdam, by the way. So here we see also the aggregated component. The areas that are like yellow are areas that have a high level of accessibility, whereas the bluer, purple, more purple ones are with lower levels of accessibility. So you can see that within a 5-minute walk for this grid cell, how many places can be accessed and what are the places. So primarily food and drink places, not really any cultural public spaces. So it gives you that kind of nuance as well. And here we see like about 119 and 91. Whereas here, it's only 11 places that you can access. So you see the discrepancies in terms of access equity in different neighborhoods of the city. And then we can also go and look in detail. So if we focus on, so for example, here, and it can go at the street segment level, we see that playground over there, and we see that it is accessible by at least 95 kids based on the impact on the area. And then it shows how the different locations score below, above, or on average for different population groups. So children, elderly, and then the age diversity. So this one is not really very age diverse because here is a new area and it's mostly like with new families with children. So it's not very accessible with the elderly. But as I said, this is one aspect which is based primarily on distances and times and the population things, but there are all the other nuances that I explained before. So we integrated those as well into other scores that you see here in a walkability score that you can see for the different areas in Amsterdam, also in this case. And then it gives you a score for this area based on how it scores across the different characteristics. So you see how it scores in terms of landscape factors, traffic safety, proximity, infrastructure, etc. And then we can also see how these different components play out. So here you see how the different walkability scores are calculated, and then you can see how it changes if we focus on some of these components. And then you can zoom in. A little bit back. So you see the different factors here. And then you can zoom in and go even at the street segment level. So you can see here again, like the 5 and the 15-minute walk, and you can see like the walkability. And with the 15 minutes, how it changes, the walkability score based on these different factors. And then go deep into the urban fabric and see even at the street segment how each street segment scores. And you can see here in the spidergram over here how the different factors play out and why we get this score that we get. And this is something that comes from the consultation with the different stakeholders. Oops, excuse me. So you can see here like the score. So for example, if we look at yeah, right. Let me go back a little bit. Yeah. So here you see the street score based on landscape factors, and then you can get an understanding of what we mean and why it's scored like that. So for example, it has 0 amenities, 0 public benches. There is just 17% of green coverage, 0 parks and plazas, and mostly the space is covered by parking spots, which are usually occupied. So all these things make up for that street score, and that's how it's calculated. So there is also a tutorial that you can follow. There are the links, and I will share them also in the chat to have them after. So you can play with that tutorial. It's a step-by-step like basis. I can show you afterwards if you want. So you can click on each and every component, and then it helps you navigate the platform and what it does and different characteristics. And there is also one where you can play with it and answer a survey on how it helps you identify this characteristic. So this is usually for urban planners, mobility planners, and then we try to explore how these digital tools can help you in capturing different factors of pedestrian accessibility. So I will share the links as well. And with that, I would like to thank you very much. And let me just stop sharing the screen so I can see you and I can see the chat.
Okay, thank you very much for the wonderful talk. And I will give you some questions from the chat. And the first two questions from me. The first question is, in your first study, could you introduce some important factors identified as influencing children's mobility safety, aside from crossing roads? Were there any factors that are particularly unique to the children?
Yeah, excellent. So indeed, so of course there are the main roads indeed that we have, like the highways that play an important role to that. You know, there is also an aspect when it comes to calculating children's accessibility that we have to factor in the perceptions of the parents. So if we want to allow children to go there autonomously, to play there without any supervision, then we also need to factor in the perception of the parents, because they are the ones that they will give the final permission to do something like that. Other components that played out, it has to do with the width of the green space or the play space. So we identified that there is a pattern that when a green space is wider than 250 meters approximately, then children will not even cross it to, for example, on their way to school. That means that, the core of that green space becomes less and less used. and that increases the feeling of a safety, which means that if that's a call to action, if you want, that if we have wider green spaces, they can even act as barriers to mobility of children, and then they have to follow the routes around those spaces, increasing the total amount of time and the distance, of course, that is needed to go and visit their school or like another playground. So if we want to make it like feel safer, sometimes in parks they put the activities around the periphery, but this is exactly where it's not really needed because there is some life from the streets as well. Where it's needed is more like to the core when we have big parks. So what I'm saying is that even in green spaces, it's not like a one size fits all kind of thing. It's not like green is always good. We need to make sure that, it doesn't create another layer of unsafety in the area, or it doesn't create another layer of an extra barrier when we're moving around the city. So that was also another aspect. Lighting conditions were another one. And here in the Netherlands, we also have large water bodies. So we have canals. And that means that we cannot just cross the canals from wherever we want. We cross the canals from bridges, and then the state of those bridges and everything and how they feel, they can play an important role in how safe or unsafe it is perceived.
Oh, okay, thank you. Oh, for the people, oh, okay. Do you want to ask the question in the voice, or please raise your hand or say something when this, in between the questions? Songmin, do you have a question?
Yeah, yes, I do. First of all, thank you so much for your talk. I think my question really relates to what you just mentioned and said, answered. So my question was around the perception of greenery. As you mentioned, as you just mentioned, not all greens are the same. The feeling of greenery is also different, but at the same time, I think um, whether it is incidental or intentional, accessibility to greenery can also change the perception of the users of the citizens. So it was kind of a discussion question maybe, but I wanted to ask how that would affect the accessibility perceived by different age groups, because incidental may imply the environmental kind of accessibility, but I think psychologically intentional visits or intentional accessibility might imply a better benefit. So I
Mhm.
just wanted to ask your thoughts on that, whether that could
Sure.
be incorporated or yeah.
Yeah, this is an excellent question. This is exactly like one of the main aspects that, it's been a very challenging one, not only within the mobility domain or, the planning domain, but also the environmental sciences, the exposures, because we're talking a lot about exposure to green space, and that usually entails spending time in green space, which means that we have the intention to go there and spend time to do that, exactly as you're saying. However, exposure is also on our way to different destinations. In the case of children, for example, that I presented, so what would be the exposure on the way from home to school and the other way around? Like, what are the routes, the potential routes that they would follow when they go to school? And do they have like greenery along that, or do they cross greenery along that? And this is where we found also these patterns, if you want, these results when it comes to the width of the green spaces and how children would or would not cross them. So there is like a threshold there. Now, when it comes to the perceptual aspect, this is very important. And the other thing there is like, how do we measure that? Usually, when we say, even though we identify these nuances, exactly as you said, when we go back to find data about that, we usually have two main sources. We either go mostly in the planning domain to open sources like OpenStreetMap, for instance, and we see what is predefined as green there. And the other way is what we call the satellite imagery, the NDVIs, vegetation index, right? So we also performed a study where we put these things to the test. What we did is that for different cities across Europe, South, Middle, and Northern Europe, we got hundreds and hundreds of different green spaces that are tagged as such on OpenStreetMap, and we also got their NDVIs, but also spaces that did not appear as that. And then what we did is that we tried to measure the perception of greenness for different people. So we had hundreds of crowdsourcing participants move around those spaces and give their perception of how does it feel like in terms of greenness, and also not just give a score, but give a reasoning behind this score. So we got as well a lot of qualitative data on the nuances behind the different scores there. So we saw which are the aspects that contribute to a space feeling more or less green. So for example, spaces that are defined as green on OpenStreetMap, and we would consider them in our calculations, right? They were perceived as not really green because the surrounding environment was very densely built up and it didn't give that kind of impression. So we found a few patterns there that can give some guidance when these characteristics exist, that perhaps we can weigh these components less than others. So we also tried to do that. And of course, when it comes to like intention of use, or perhaps like just on the like just walking by, there are also different components. What are the amenities in those green spaces or play spaces? What is the infrastructure there? What is the quality of that? All these factors play a role when it comes to, okay, I'm going to visit this space and spend time there. I'm going to cross it while I'm going somewhere else, and all these aspects. So all these play out, and it becomes a very complicated one, but it can give like a more nuanced picture of just, simply calculating distances and times and talking about 15 minutes simply or 5 minutes or what have you.
Yeah, thank you so much.
Yeah, sure. I also see another question, I think, from you, Sejong. You say, as far as I know, the Netherlands has a very high rate of bicycle usage, which is very true. I was wondering if bicycles were considered in any case in your studies for the 15-minute city. Well, we do have a lot of studies that also deal with cycling. That, of course, means much larger distances because we can cover much larger distances. That also helps, as I said before, that we have a very flat country, so that helps a lot with cycling, and I think it's one of the main reasons that it has become like so popular. We do have some studies. For the ones that I presented today, they focus explicitly on pedestrian accessibility because it's also the most vulnerable group, and it's the one that we need to make the most effort. So that means that, okay, yeah, we need to, if we decide to go somewhere on foot, the whole perception of that travel cost will influence our decision. How we perceive it, like how far or how close we think it is based on, the weather conditions. So cycling is, I cycle to work. I work in the building that you see right behind me in this background here at TU Delft. But the weather is, well, it can be quite harsh here. And that makes it, however, we do cycle in all weather conditions, but it can impact our planning. But what you saw today, it's explicitly focusing on pedestrian accessibility.
Yeah, I was wanted to ask because Korea has so many mountain even in the city. as you know,
Yeah,
we have
yeah,
you did it in
indeed,
here. Yeah,
indeed.
yeah. So I was curious,
Uh,
and I saw Junyoung wanted to ask. So could you ask?
I also put the
Yes.
links there if
Oh,
anybody
oh, thank you
well
very much. Yeah.
click like the
Uh,
text. Yeah, sure.
okay. Hi. Thank you for your fantastic talk today. I was wondering about a rather general question about like the subjectivity of the metrics that you're using, such as accessibility or safety or feelings. So in general, when you're studying on matters that are quite subjective, other than things that are very obviously that can be obviously quantified, what are some strategies that you would take to deal with that subjectiveness, like
Yeah,
the
so
work you've done this year? Yeah.
yeah. Yeah, sure. I mean, the issue with the subjectivity is that we can never be, as objective as we like. And let me start with this one first. Like sometimes, um, let me pose that question. Do you think distance is an objective or a subjective factor? And that's to everyone, not to you only, Jiyon. What do you think? Like, who says objective? Maybe you can raise your hands. We can do this game. Nobody? Or you just don't know where the raise hand is? Uh, so you all think it's a subjective uh, factor. All right, that's great to hear because oftentimes, also in the literature, we see that the distance is perceived as something very objective. Like we say, oh, 500 meters, 800 meters, and that translates into, we usually translate it into time, which is more intuitive in this regard. But then, indeed, the distances I presented is something which is also very subjective because it can play out differently depending on your condition at this time. So with this subjective properties, the main challenge, as you can imagine, is that we can only use approximations. We can never be entirely sure about that. So also the thing with the feeling of safety that I presented, we use an approximation, a proxy there, which is the overlooking windows. So the openings because there is, and there has been shown that there is some relationship between, the presence of overlooking windows and the overall feeling of safety as you walk along a route. Of course, different qualities of windows, whether some stores, for example, are open or not, so different times of the day, the level of light, these can all play out differently, but then it's a way to introduce these aspects as well in the metrics and take them into account. Because as I said, what strikes me all the time whenever I perform these workshops with different stakeholders. We did that with different groups also from the American Planning Association in Boston, also with people from MIT. And what we saw there is that because first we gave like the assignment to rank the different factors generally, like what they thought it would be important for the different, like for accessibility in general. And then we split them into groups and we gave them a different population group, like for each and every group of planners there. And they didn't know that they got like this different assignment in that sense. In between among the groups, they weren't aware of that. So what we asked them is like, would you keep the same ranking if we were to talk about pregnant women, if we were to talk about elderly people, if we were to talk about children, etc., would you keep the same ranking and would you keep the same components, or would we like to introduce new ones there? And then when we came back, we saw how the initial diagrams changed just by looking at like the different groups, which is like amazing. And then it makes you think about critically about the way that we try to measure this stuff in our daily work, because we do it um, more easily with the objective factors or what we think is like more objective in this regard, distance, time, whereas these also are very subjective in essence. I hope I didn't forget anything, like I'm answering your question.
Oh, it was that was a great answer because I actually thought that the number of windows that using that as a proxy for the safety metric, I thought that was very interesting. I've never heard of that. So,
Yeah.
if I understood your answer correctly, even though the metric is subjective, we can find some like a proxy that acts as a bridge between our interest and the matter that we're trying to measure, even though
Right.
it's subjective. So,
Right,
thank
right.
you. Thank you for your
Indeed,
answer.
indeed. So
Mm.
it has to do with, so for example, here, what we showed is that the potential that exists if we have data, if we can identify the openings along a route, it can give us an understanding because we saw a very consistent pattern there and a relationship with the measured fillings of safety by asking questionnaires. For example, we had this great possibility in Amsterdam because we had this data sets to compare it to. So that was amazing to figure out whether this makes any sense. And then we could, assess our methodology there. And it is a way, it's not the only way, but it is a way of approximating that and give some essence of a potential feeling of safety when walking along a route.
Thank you so much.
Sure.
Okay, so I think we need to finish it here. Thank you for the wonderful talk and wonderful and fantastic questions. So thank you everyone for joining us. And I'd also like to thank our sponsor, GNC, for providing financial support. And the next week, we have Professor Hanfa Chen joining us next Thursday, an associate professor in spatial data science at the Center for Advanced Spatial Analysis, University College London. So thank you for a great talk, Achilleas, Professor Achilleas Psyllidis. And then have a happy week and hope to see you again next week. Thank you very much.
Absolutely. Thank you all. Thank you all for participating. I really enjoyed it, and I
Mm.
hope to see you maybe soon in Korea.
Mm. Yeah. See you maybe in Korea. Yeah.
Thank you. Thanks, everyone.
Thank
Thank you
you.
very much.
Thank you.